on emerging issues with sole community provider hospitals. And Ms. Michael, are you going to be doing the presentation? Okay. Thank you.
Good morning, Commissioners. Jamie Michael with Health and Human Services Department. I'm filling in for Sylvia Sierra this morning. Just wanted to brief you on what's happening with our local hospitals. Every year we come to you with information that the hospitals share with the Health and Human Services Department staff and our Health and Human Services Alliance. So this year was no different. The hospitals submitted their annual financial reports. They provided tours of each of the hospitals, and they each of the CEOs presented to the Alliance. We were privileged to have the opportunity to meet the new CEO of Memorial Medical Center at that time, and both CEOs provided wonderful tours of each of the hospitals. So we were able to see some of the new projects and some of the ongoing services that the hospitals provide to the people in our community. Here's some data. We have 5 years of financial reports, but the last 3 years we were finally able to have both hospitals sit down and agree on a format, so we're able to actually compare some of the data. So the line that you see on the top is the number of indigent patient encounters at Memorial Medical Center, and the green line on the bottom is the number of indigent patient encounters for Mountain View Regional Medical Center for the last 3 fiscal years. This slide is the number of individual patients that qualified for the county's indigent program, and you can see that because Memorial Medical Center is a public hospital, with the relationship between the county and Memorial Medical Center, they see the overwhelming majority of uncompensated or indigent qualifying patients. The hospitals also report to us the total cost for providing services to people who are qualifying for the county's indigent program. And again, the line on top is the number of dollars for Memorial Medical Center, and the line on the bottom is the cost in dollars for Mountain View. Those numbers are important because we want to make sure that they are able to justify the amount of money that they're getting for sole community provider, and we know that the people who qualify for the county's indigent program are getting proper care as they are required for hospital-based services. This slide shows the amount of dollars each hospital has received over the last 3 years as part of the federal program, the Sole Community Hospital Provider Program. This is where we usually come to you in January, and we get a county match. All of the counties provide money to the state. The state then is able to send that up to the federal government, and there is approximately a 3-to-1 return on the dollars for the state, and then the state distributes those dollars back to hospitals that qualify for sole community provider. Most of them are rural hospitals that provide services to people who are under or uninsured. So this is the amount of money. Again, Memorial Medical Center gets a great deal more than Mountain View because that is proportionate to the number of people that they see that qualify for the county's indigent program or that are uninsured. You also notice over the last year there was a decrease in the amount, a very substantial decrease in the amount that Memorial Medical Center received, and that amount, the projections is that is going to continue to decrease. Some of the reasons that there are some of those changes, we know that there are a lot of changes at the federal and state level. Coincidentally, we had Centennial Care, which is the state's Medicaid program, and the rollout of the Affordable Care Act all happening at the same time. So under those programs, the traditional sole community provider program that we were all familiar with has ended. It will end the end of this calendar year, so December 2013, that program ends. So the hospitals only received 6 months or the first 2 quarters of their sole community provider dollars. They will not receive the last 2 quarters for the current fiscal year. The state is rolling out a lot of changes. They were able to fairly recently get their Medicaid waiver approved by the federal government. They're rolling out Centennial Care and all of the MCOs. So as all of these changes are happening, everybody's trying to keep their eye on all the balls that are in the air. And our director and myself and Sue Padilla have been meeting with people from the Human Services Department, with the New Mexico Association of Counties, and with the local hospitals. We've had several meetings with Memorial Medical Center to figure out what we need to do to make sure that the hospitals in our community receive the funding and are able to be viable and continue the good services that they provide. So there are a lot of different scenarios working out at the state level. There will be a new system for reimbursing hospitals for either uncompensated patients or the Medicaid rate, which is much lower than the actual, what they get reimbursed under Medicaid is much lower than the actual cost of care. So they're trying to figure out how to adequately reimburse all hospitals in New Mexico. This is not just a Doña Ana County thing. And we will come to you as some of those solutions are worked out or as action needs to be taken at a local level. But we wanted you to know that the hospitals are continuing to communicate with us, provide us with all of the data that we need, and we are in contact with the hospitals and the state to identify the best way to implement some of these changes. We will not be coming before you in January for the 3-to-1 match because, again, that program has ended. So we will figure out the best course for moving forward, and I will stand for any questions.
Any questions by the Commissioner? Commissioner Garcia?
Mr. Chairperson and Ms. Michael, I would just want to thank you for, I've seen you doing all this work, and, to some people, it is something that is very complicated because you actually can't predict the future, especially when it comes down to Centennial Care and the Affordable Care Act. We're still anticipating a lot of changes, and changes sometimes are kind of scary, especially for our citizens, but I'm glad, and I say thank you for doing a good job for the county. Thank you.
Thank you.
Thank you, Commissioner Garcia. Commissioner Rawson, any questions at this time? No. Commissioner Hancock, any questions? Commissioner Benavides? I would simply observe that there's some very interesting information here. I would note that there's a drop in funds received of over $17 million for MMC. At the same time, the cost per patient went down. The number of patients went up. And if I'm reading this correctly, the amount provided to Mountain View Regional Medical Center was greater than the cost of the services provided. Now, I'm not going to ask to go into all of that. I'm just saying that there's some interesting relationships between those numbers. And I'm going to suggest that the Commission would probably benefit from a work session as we get into the new year at some point, so we actually can get a better understanding of the numbers and of having a grounded basis as we move forward into discussion about the alternatives that we'll be considering. As Commissioner Garcia notes, this is a complicated process, and we do, I think, in terms of our objectives, we're concerned with making sure that health services are provided to the residents of the county in an efficient and cost-effective manner. So we just need to understand more about this, and would that make some sense, Commissioners, to have that as an item for a work session at some time in the future? Commissioner Hancock, you okay with that? Yes. Okay. So if we could just put that on the future to-do list, Ms. Brown. Appreciate that. Thank you very much, Ms. Michael.
Thank you. And in respect to Centennial Care, we are working to make sure that enrollment is accessible. In fact, this past Saturday, several of the providers, La Clinica, the Doña Ana County Community College, several of our other contractors, including the Sea Valley Hospice, who really is just participating as a good community member in this, they put on an enrollment fair, and over 50 people were enrolled in one day at the community college there. So we are really trying to get the word out about getting enrolled in Centennial Care and also in the New Mexico Health Insurance Exchange. Thank you.
Thank you. We will now move on to the